Hi, everyone. Welcome to our webinar on enriching the health of your students. My name is Lauren Bino, and I am a program manager and health educator here at Cancer Pathways. Our mission at Cancer Pathways is to ensure that no one has to face cancer alone. This is achieved by offering educational, supportive, and community programs for those impacted by cancer. We have a beautiful clubhouse located in Seattle, Washington. However, many of our programs are available throughout the state and even across the country, especially our Cancer Happens program that we'll be focusing on today. With that, I will introduce our program manager for Cancer Happens, Jana Mastrogiovanni, who will provide you with an overview of our Cancer Happens program and e-learning platforms and how these free resources can facilitate student learning in cancer risk reduction. Janna is a licensed therapist whose specialty is working with individuals and families coping with life-threatening disease. She has over a decade of experience working in the cancer field and participating in projects related to health and chronic disease. She began her work at Cancer Pathways as a group facilitator in 2013, and since then has led efforts toward the development and implementation of the Cancer Happens teen education program. Before we get started, just a quick note that today's session will be recorded, so we do ask that you please remain muted unless prompted to unmute. Feel free to use the Zoom chat box for any questions you have, and we can address those at the end of the presentation. This webinar has been approved through OSPI to provide 1 clock hour to educators in Washington State, and you will receive a post survey at the end of the webinar and after the webinar in your email that is required in order to receive your clock hours. So I am now going to turn it over to Jana.
Okay, thank you, Lauren. Appreciate that introduction. Hello, everybody. My name is Jana. I actually started out as a licensed therapist, a group facilitator at the clubhouse in Seattle. I loved working directly with those that were impacted by cancer, family members. But I also was very drawn to the teen education program too. And I have just slowly migrated more and more to the teen education Cancer Happens program. The longer that I have been with Cancer Pathways, I love working with teens. I love working with schools. I think the program is wonderful. So that's a little bit more about me. I'm starting to see some of you guys come in, and I'm actually recognizing some names, which is exciting. I see some new names and some familiar names. So some of you, I think, have actually used our program and maybe one way or the other. So maybe we get some feedback from you guys throughout the presentation too. And I'm excited to see some new names. Awesome. All right. I think we distribute surveys to all of our students. We try to track, and it is kind of challenging sometimes, but we try to track how many people participate in our program. And as of the end of last school year, we were over 100,000 students. So we're really excited about that. I think the pandemic and transitioning to virtual has probably slowed that momentum down a little bit versus when it was in person. But we've actually done and seen a lot of positive results from transitioning to virtual presentations as well. So, okay. I have a quick video to share with you guys. Let me see, test my technology, see if it works. I don't know if anybody found any of those statistics surprising. Feel free to throw any of that in the chat box. I think it shared a little bit about the stats about how many people are impacted by cancer, almost half, men and women. And then showed some statistics on certain risk factors that we focus on throughout our presentation. You know, e-cig vaping use, tanning beds, I think HPV vaccine, which those are all topics that are covered during our presentation. Which is kind of a good lead in to our next slide. You know, why is this important? You know, why do we feel like we need to be coming to schools and talking more about what cancer is, you know, what we can do to hopefully reduce these teenagers' risk of reducing certain types of cancers. You know, we know that we can't prevent all cancers. We talk to the kids about that. Not all cancers are preventable, but there are certain things that we can do to, you know, hopefully reduce our risk of developing certain types of cancers throughout our life, even during teenage years and later. A couple of things that just stand out. You know, cancer is the second leading cause of death in the US. I don't know if you knew that. And actually, if most of you, I think, are in Washington State, it's actually the leading cause of death in Washington State. That was a recent change, and it may be even in other states as well. But overall, second leading cause. So it's impacting a lot of people, right? It is impacting our students. Based on our student survey, 3 out of 4 of our teens are saying that they've already been impacted by cancer. You may already have students talk to you about this. You may have, you know, students or teachers or staff members in your school that are already being impacted by this. And when we say 3 out of 4, you know, that doesn't necessarily mean they're all 3 out of 4 teens are diagnosed with cancer. 3 out of 4 teens are impacted, you know, whether it's personal, family member, someone that they love. And I think we all know that that is still impactful for that person. This was a survey that we did with teachers, I believe in 2019. This is one of the questions. You know, we feel strongly that, you know, cancer education should be required in health education curriculum. And so we surveyed, you know, we were curious what other teachers, you know, what teachers thought that were actually in the classroom. And you can see, you know, over 90% of teachers thought that this material was important and should be required. And we are seeing some of that slowly shift. I think we talk about it a little bit in a different slide, but we are in multiple states and there are different requirements in some states. And we are starting to see certain risk factors or certain types of cancers are being required in health education curriculum. Let's see. In regards to aligning with standards, we have a lot of respect for your teachers and educators and staff. We know that you are very busy. You know, we try really hard. We collaborate with educators in school and try to align our curriculum with standards. We do most often work with health education. Our standards align really well with the National Health Education Standards. Most of our teachers are health educators, health science teachers, nutrition, family consumer service. Those are a lot of the classrooms that we often are in. However, this information is relevant for all teens. I think you just see us in those classrooms more because it's easier for the teachers to fit it into, you know, what they're already being required to teach. And if you take a look at, these are some of the main topics that's being taught through our presentation, you can kind of see how they do align with a lot of the Common Core standards or the Common Core ideas. You know, we talk about, you know, cancer prevention, disease prevention, the basic cancer facts, a lot of terminology that goes with that. We certainly talk about tobacco products, a lot of focus on e-cigs and vaping. I think based on our teacher survey last year, that was the #1 requested topic that we talk about. And we have since then actually created a new online module that specifically focuses on e-cigs and vaping, which I'll definitely share more with that. Lifestyle choices, healthy food choices, nutrition. Like we know that's certainly a part of the curriculum. Exercise, sun safety. I've done work in South Carolina, and I know for sure in that state that they require some sun safety, skin cancer content, and that's written in their standards. Human papillomavirus, HPV, self-exams. We also have a couple schools up north, New Jersey, New York, and they now require cancer education on breast cancer and testicular cancer and self-exams. So I think it's slowly happening. That's a lot more than where it was when we first started presenting. And another big topic we touch on is family history, and encourage students to find out their family history if possible. But we also let them know that, just because somebody in their family has cancer does not guarantee that they're going to get diagnosed with cancer. So we give them a lot of information, but our hope is that, they take this information, we give them empowering steps that, they can make actual behavioral change with. This is, how do we know our program works? Which I think is a great question. We do, and if you've worked with us before, pre and post surveys. We've been doing this program for 15 years. Our first presentation, we were actually asked, I think in 2005, a Seattle teacher just asked us informally to come talk to her class. And then it's just evolved into a much more comprehensive program since 2005. But most of that time, and we still have the data to prove it and to show it, we have been collecting surveys from almost the very beginning. And we really value student feedback, teacher feedback. And on the screen is some of the things that we've seen over the years, but this is specifically to results from last year's survey. So what are the teens reporting after they participate in our program? Their intent to reduce tobacco use, increase physical activity, start doing self-exams or perform them regularly. And then they're also showing an increase in knowledge. We have pre and post surveys. I think I mentioned that. Last year, I was looking at some of our numbers. We had over 8,000 surveys. And on the pre-surveys, I think the percentage of correctness was around 69. And then on the post survey, the percentage of correctness was like 95%. So we've seen at least a 30-something% increase of knowledge. And those are the same questions on the pre and the post. But also giving them resources, also trying to connect them, and giving them ideas to kind of further their education and opportunities to get involved with their community. Any questions or thoughts so far? I haven't looked at the chat. Okay, you guys just let me know. So how do you implement Cancer Happens with your school? We have two main options. There is right now the virtual live presentation. This used to be our in-person presentation, and we've adapted our in-person to this virtual live presentation. So it takes, 45 to 50 minutes, kind of a standard class period for most classes. We have trained health educators that go through a training program with Cancer Pathways in order to become a health educator, and they present the material to the classes. This is the presentation. This is our main presentation. This is the one that covers, the basic cancer facts, a heavy focus on cancer prevention, risk reduction tips, all of those topics that we were looking on that slide previously. And then Lauren is she's one of our health educators too. Lauren and I right now are the ones that do most of the presentations. So if you have questions about the presentations, we are happy to answer those. And then our second option, so we did the in-person for probably close to 10 years, and about 5 years ago, we developed online modules. This was before pandemic. This was our attempts to reach more schools, more students. So we developed, basically adapted our in-person and created them online. There are benefits to online. I know that some people that are on this call right now have used our online modules, e-learning course. They're flexible. Your students are able to use these at any time. They're self-guided, narrated modules. Takes about the same time, about 45 minutes to go through the main module. What we do is we create teacher accounts, student accounts. There's multiple ways to kind of access the course. And then we also created that second course that I mentioned a minute ago, the e-cig and vaping course. That's a shorter course. That's a very specific targeted course on vaping and just goes a little further in depth than we do in our general presentation. So would we suggest using both? We have, what I've seen most often, because the live virtual presentation and the main e-learning course is basically the same content. So your kids wouldn't necessarily be learning anything new. The reason that we kind of have both options is, it's just a preference for schools and teachers. Some want that interactive presenter from Cancer Pathways, and some like the flexibility of having the students be able to maybe do it from home, or maybe they missed a day, or a lot of students have Chromebooks now and they can take that course. A lot of people want to incorporate technology in their classroom. So I think there's a lot of different reasons why some schools choose e-learning. In regards to that new course, I have seen a lot in the last year. People will do our main presentation, whether it's virtual or e-learning, and they will also do the online vaping course, because that is new and additional information. And hopefully that was helpful. Okay. I am going to take you guys, I do want to show you our online modules because they are very easy to access. I don't know, has anybody used our modules that's on the call right now? Yeah, do you want to share anything, Michelle, of what that's been like for you? I'm putting you on the spot, aren't I?
No, I just unmuted myself. Can you hear me?
Yes.
Okay. It actually was amazing because the first time we used it is when we first went home, the very first spring of COVID, and we were all panicking like, oh no, what do we do? It was, kids were home, and it was right at the end of that first semester in March. So other than me completely messing up the passwords, I think twice, and you saved me. What you did, and it was so user friendly, everybody just used my account, I think is what we ended up doing. So that was so kind of you. So it was just me, my account, and I had like 1,000 sophomore users. They were all me. So it made it really nice. And we've continued to use the online platform up until last year. And so I would, that's what we're trying to decide which way to go at Curtis. We're not considering not using it. We're just trying to figure out how. But if you have, we're all at different places. If you're in a learning community where kids have their Chromebooks at school every day and you want them to work independently and just monitor, I think the online would be fine. There are lots of videos. I think one time we had to go through and approve them the first time. They were blocked. There was a few little glitches, but I'm sure that's all been resolved. And, so kids can work independently or they could work in groups. I've also seen it live before COVID. So we've had you with us for a really long time. And I think personally, the kids probably really enjoy having a live human in their classroom. The speaker was a real young lady that was really vibrant and outgoing, and kids always would prefer that over like a 60-year-old any day. So they were just like, this is great. So, it just depends, I would assume, on the audience and then and what they want. But I think the online platform or the e-courses are great as long as it worked and you were just great at setting up. It's pretty easy. So
Awesome. Thank you,
yeah,
Michelle.
of course. No, I don't mind at all. I'm just kind of here to figure out all the new things you've added. We're looking at adding the vape your vaping edition because we're currently using Stanford's curriculum on that. So we want to add to it a little bit.
Yeah, you touched on a lot. And I can see our chat box too. We are eager to get back into the classroom. We love being in the classroom. We are still virtual only. I am very hopeful that we will be back in the classroom soon. You guys will be the first to know. But I do think these other options have worked out really well in the meantime. And there are a lot of different ways that you can use our e-learning courses. And I think that was actually, I did not plant Michelle to say all of that, but she has used a lot of different pieces of our program. So that was helpful. Let's see. So I'm going to attempt to show you guys our e-learning course very briefly, just so you can see what it would be like. So I'm going to end my slideshow, stop sharing this screen and share a different one with you. Okay. So if you were interested in using our program, you would register online on our website. There's a short registration form just to give us more information, you know, which format do you prefer? Do you prefer the virtual in person? Do you prefer the e-learning modules? And then we would get some more information from you based on that response. If you chose e-learning, you get a link to our e-learning page. This is it, and you will get a password. So in most cases, what we do is give teachers an account and students account, and you can have individual accounts for all of your students. And I think there's pros and cons, and that is definitely a teacher preference. The pro to that would be that you would be able to track your students' progress. If each student had an individual account, you could track whether or not they completed the course. If you do one classroom account, which is kind of, I believe, what Michelle was saying, you don't have to keep up with all the different usernames and disseminating all that information to your students. One account, they all go straight to it and use the same account, but you do lose that ability to track their progress. So it's kind of, you know, just what your preference is. So I don't know if I gave you guys any time, but if you have access to a device right now, you can pull this up and I can give you our preview account. It's just cet.cancerpathways.org. I don't know if you guys, can you all see my screen? I just want to make sure. Thumbs up. Yeah. Okay. Okay. Thank you. I got one thumbs up. Thank you. That's all I needed was one. So username, if you want to do the preview account, we can do teacher. You can type in teacher and the password is cancer. I'm going to log into my personal one, but if you guys want to see it, that is what you would do. Hopefully that gets you guys in. Once you're in, you will go to my courses. And this is the Cancer Happens. This is the new course that we update every year. This is basically the same thing as our in-person presentation. And then the other course option that we have is E6 and vaping, and everybody will have access to both of those courses. If you have a teacher account, you'll have this additional option to go check out teacher materials. We'll talk a little bit more about that, but that's extension activities, that's additional videos, you know, follow-up activities, discussion topics, assessment tools. You can certainly go in there and play around. And then just to give you guys a brief preview of what the actual course would be like for your students. It might pop me onto a different screen. Tell me if you can see this. What is cancer? How can you guys see my second screen? Yes, thank you, thank you. So this is it. This is the main screen. It is going to be a narrated. You have kind of all the topics over here on your left. You know, you can go here and click on this just to give you a preview what some of the slides are.
Smoking and tobacco use with lung cancer. While this is true, and lung cancer is the leading cause of cancer death among both men and women, smoking is also linked to at least 13 kinds of cancer and many other health problems. As you can see in this picture, smoking harms nearly every organ in the body.
I personally like this slide because a lot of people just assume that smoking only increases your chances of getting lung cancer. It actually increases your chances of getting all those cancers highlighted in red on the left-hand side. And I also think this is a great opportunity for, health education classes. It also increases your risk for all these other chronic diseases that you might have already discussed or talked about, or you might be talking about. So there's some overlap in some of our information and other diseases as well. So that's just a preview. I wanted to show you guys what that would look like, how easy it is to get in. Your students would be doing the same thing. They would just have a different login. And then it will prompt them to do a pre-survey and a post-survey. There are links to both of those at the beginning and the end of these presentations. So they will also be doing that survey. Okay, so I'm going to come back to my PowerPoint. That's kind of a preview of our course. This is just more content that is in our presentation. Like I said, we do touch on e-cigs and vaping. The kids have lots of questions in regards to this topic. There's so much information, as you all probably know, that comes out daily, weekly. We really try to stay as up to date as we can. And then the bottom left is, one of our slides. This is really, I think, helpful and informational and provides them with a new skill. We walk them through how to do their own self skin exam. And we talk about, they call it the ABCDEs of melanoma. And we go through each of that and what to look for. Talk about, making sure that they have a connection to a healthcare provider. It doesn't have to be a dermatologist. Do they have a school nurse? Can they talk to their teacher and help them get connected with somebody if they needed medical services or if they were concerned about some symptom? We talk about HPV. We talk about the virus in regards to cancer, prevention. It can lead to 6 different types of cancers. It is an STI. We certainly stay away from any sex ed. We are not a sex ed curriculum. We do talk about the HPV vaccine because that vaccine does help prevent someone from getting these different types of cancers that you can see on the screen. These are just some of the extension activities. Again, we know that teachers are busy. You have a limited amount of time. If you had extra time, after our presentation, you wanted to further their learning. These are a lot of the different activities that you can find online in your teacher account. We've gone through videos and showed you ones that we thought were, relevant, accurate for teens. Movie recommendations for teens, just a lot of good information in there. And then regardless if you choose virtual, in-person, e-learning, every teacher has access to this online teacher account. Okay, so that is a good question. Holly's asking if you can use all the same accounts that you used from last year. Ideally, I think technically you probably could, but we lose the ability to track how many users we have. So we like to create, fresh new student accounts for you guys every year. Other teen opportunities. This is something that has also continued to evolve over the year, based on our surveys with students. I don't know the exact number. It's definitely over half, put on their survey that they want to stay engaged. They want to get involved, more involved. They want to participate in some of our teen opportunities. So we really want to foster that and provide these opportunities. One thing is being a volunteer. We have a lot of different volunteer opportunities, throughout the year. I think one that's popular with teenagers is volunteering for our Camp Sparkle. That is our kids camp that we have in the summer months. Sometimes teens will be the junior counselors and help our staff. I think that's a really great experience and opportunity for teenagers. We had a lot of people participate in our pen pal. That was something that, we adapted from going virtual camp over the last year or two. We did a lot of pen pals. So we had teens volunteer for that. So different opportunities throughout the year. We also have a family support program. We have social workers on staff. Again, if you have teens or families that are impacted by cancer, you can certainly reach out to us. You can connect with our social workers. We have different kinds of support groups. We have different family events. We have different wellness events. Lauren leads our community education. There might sometimes be some educational opportunities for families that are dealing with a diagnosis. So that is a huge part of Cancer Pathways. And then let's see, we have our Teen Ambassador Program. That is a little bit newer compared to these other ones. And that's really just to give, interested teens an opportunity to be more of a leader, in their community, in their school, help us kind of spread our message, spread the word, help educate their peers. And they certainly provide, some young new energy behind all of our efforts too. And so there's application online if any teen, there's certain steps that they go through in order to become a teen ambassador. And then Cancer Unwrapped. I don't know if anybody from your schools have participated in this program. I love all of our programs. I'm going to say I love this program too. This one's been around for a really long time. As you may or may not know, everybody experiences cancer, differently. Without a doubt, a lot of intense emotions. Some people like to talk about those things. Some people like to write about it. And that's kind of, how the teen writing contest started. It started in Washington State. We have a family kind enough to offer money to our winners. We offer cash prizes to students every year. We are now accepting entries for the writing contest. These are some of the details. You do have to be 9th grade or older. It's only open to high school students. The essay, doesn't exceed more than 1,500 words. Our deadline, as you can see, is March 4th. We get thousands of essays. Lauren, I don't know if you know how many we had last year. It's a lot. It's impressive. And, I think that's also a great way or resource. We post all of the winning essays on our website. I mean, if you want to read a real story from a teen impacted by cancer, you should check those out on the website. They're very heartfelt. They're very well written on top of everything. It's just kind of amazing, what they've gone through and then them being able to share that. Is there anything else I'm missing in regards to the writing contest, Lauren?
I was just going to say too that it's teens write about either a personal diagnosis or just how they've been impacted through a family member having cancer. So it's those two different categories.
Yeah, we have two different categories, and it is open to all states now. So yes, strongly encourage, if you guys have any students that want to write about it or have had a cancer experience, this is a great opportunity. And then we do a reception as well afterwards for the winners. Yeah, awesome. Okay, let's see what else. Cancer, what to do if you have cancer in your school community. Maybe do you guys mind putting that in your chat box? Has that been something that you guys have dealt with yet? It is very rare. We haven't been in person in a couple years. It is very rare that I don't have a student come up to me afterwards, telling me that, their mom is, going through cancer treatment, as we speak. And the kids, actually, we give them an opportunity to share how they've been impacted or if they've been impacted. So if it does happen, if your school is impacted, whether it's a teacher or a student, we see kind of the two main pieces, as your role as a school is, trying to support, that student and that family, and then also educating your student body. I really like this quote. I don't know if you guys have read it. Giving students information about cancer is going to increase their understanding and reduce any risk of gossiping or bullying. Most students want to be supportive, but they need the tools and the knowledge to do so effectively. So, I do think it's helpful to educate your students about what cancer is and what it is not, and allow them kind of that forum or that opportunity to ask questions. And I also think another huge benefit of our program is encouraging open dialogue. A lot of people don't like talking about cancer. It's uncomfortable. It's awkward. That even goes for adults. But, offering this program in your school, bringing it up in your classroom, just kind of creating, a warm, safe environment so they can talk about it, I think goes a really long way. I will say the one thing that has always stood out to me the most when I was facilitating groups with patients and their family members, the one thing, that almost every single patient said was they felt alone and isolated. And so I think the one thing that we can do and try to remember to do, is always say something, never be silent, always check in, even say, I don't know what to say, but just know that I'm here for you. And just, encouraging your students and giving your students those kind of tools and tips to communicate with others. Let me see this question. And I think some people, yeah, exactly. Some people, everybody's experience is different, and we have to respect those experiences. All feelings, are valid and normal. Some people want to talk about it. Some people don't want to talk about it. And you ask and you find that out, and then you respect that to the best, of our abilities. Yeah. And you let them know that you are here if they need anything. Okay. So next steps, if you are not already registered for our program, we would love for you to register. We're a big fan of these QR codes, as you can see lately. Maybe you could take hopefully that QR code works. You can take a picture of it, and it should take you right to our registration form for the Cancer Happens. Definitely check out our website. A lot of resources on our website. All those opportunities that we talked about for teens are on our website. I think Lauren's done an awesome job of putting you some direct links into our chat box. Thank you, Lauren. And then I think the plan is to send you guys a survey, either drop it in the chat box before we leave today, and we'll also send it in a follow-up survey. We encourage everybody to take the survey. Again, we love your feedback. So even if you're not trying to obtain a clock hour, we would still want to hear from you guys. Oh, yeah. So Holly says that she just had a student's mom diagnosed with lung cancer. It's really hard. Yeah. And, just, I'm sure you guys are working with the counselor and the family. But if you need any additional support, you can certainly reach out to us as well. How about any questions or thoughts?
Do you want them out loud or in the chat box?
I'll take both.
Okay.
What's your preference?
If we are interested in the virtual live presentation, how long does it take? Like how much notice do you need? Like if we're interested in it for this school year?
Yeah, we're still open. We still have some availability through the end of this year. So you just email me or fill out that registration form.
Okay.
A lot of times, I think certain teachers, you have health classes on certain days. So what we typically ask is you send us your top 3 preferred dates,
Okay.
and we'll see if we can make those happen. If not, I'll send you back with some other options. A couple of things while you guys are thinking of your questions. We do often like to collaborate with teachers. We certainly want your feedback. We do send teacher surveys, once a year after your class uses our presentation. But there are definitely opportunities throughout the year that we reach out to teachers on certain projects that, we want more in-depth feedback about. I think one of the biggest ones coming up is we're working on developing parent materials and wanting to be able to share those, with students, parents, caregivers. So if you're ever interested in collaborating with us further, know that's an opportunity. All right. I don't think I have anything else. You guys can always reach out to us. Our emails are very simple. It's Janna@cancerpathways.org, Lauren@cancerpathways.org. Hopefully you know how to get in touch with us. We'll send more information in a follow-up email. But if you don't have any other questions, do you have anything else to add, Lauren?
Nope, I don't have too much. Just you'll be hearing from Jana or I within the next few days with that post survey again, if you weren't able to complete it, and then just some of the resources and information that we talked about tonight. All right, you guys have a great evening.
Yeah. Thank you, everybody.